Hello everybody. So this video is fifth in a series of videos pertaining to the respiratory system examination of a child. And in this video, we will discuss percussion.
The principle behind chest percussion is the same as in the musical instruments that come under the category of percussion, such as the drums, etc. In chest percussion, the striking of the surface causes the underlying tissue to vibrate. The resultant note is altered depending on the extent to which the vibrations are dampened by the underlying structures.
During percussion, you have to look for any resonance, dullness, any pain or tenderness.
When there is a relatively greater amount of air in the lungs, the sound is heard as resonant. When there is excess air between the chest wall surface and underlying lung tissue, as in pneumothorax, the note perceived is hyperresonant.
Increased resonance compared to dullness is much more difficult to detect. There is no absolute level of normal percussion against which you can judge increased resonance.
When there is fluid or relatively solid structure, such as a consolidated lung or a lung mass intervening, the note is dull and shortened in duration. An incomplete dull note is sometimes referred to as impaired note. In children with pleural effusion, percussion over fluid creates greater damping of the vibrations, resulting in stony dullness, as if one is percussing on a stone. So let us have a look at the technique of percussion. Chest percussion is an art learned with experience. Place the hand on the child's chest so that the middle finger is resting along the intercostal space. The other fingers of the hand must not come in contact with the chest wall. This is achieved by lifting them slightly.
Now tap the middle phalanx or the back of the distal interphalangeal joint of the middle finger of one hand with the middle finger of another hand and strike perpendicularly.
The movement should only be at the wrist joint and not at the finger, shoulder joint or the elbow joint.
Some authors suggest tapping the back of the distal interphalangeal joint as shown in this video. Some authors suggest tapping the back of the middle phalanx. But it's more about mastering a particular technique. Both these techniques can yield all the same result.
Lift the tapping finger immediately off the pleximeter finger and listen and feel carefully for the note produced. Percuss the lung apices by tapping the middle of the clavicle directly with the plexor finger.
So here again, some authors say that tapping the clavicle without the intervening finger can be more uncomfortable for the patient. So both these techniques can yield the same result and you have to be gentle.
All areas of the chest should be percussed comparing the contralateral sides. As you move downwards or caudally in the right side of the chest anteriorly, there will be a dull note on percussion when the upper margin of the liver is encountered, usually at the 5th or the 6th intercostal space. Likewise, percussion over heart produces a dull note on the left side. This examination technique takes practice and one can practice without patients also.
Thank you for watching this video. Please help us improve the content by commenting in the comment section or emailing at the link given below, especially regarding the length of this video, anything which can be removed or anything which can be added or any other comment and suggestion. Thank you so much.